Good afternoon. Good afternoon. Are we ready for this class?
Yes, sir.
Huh?
Yes, sir.
Then let's sit and keep an environment that looks as if we are ready for the class. Maka, Maka, please, Maka. All right. You're welcome to our today's lecture. We are still on the course PHE 101, and today is Wednesday, November. I'm still we are looking at the different terms. Please don't go there. Please, because you can match this and this thing will fall. Okay? All right. Please don't allow anybody to go behind that again, please. They can sit this side, not this side. I'm talking to you. Huh? Yeah. Okay, so we started by defining terms that we encounter in this course, and we've defined a lot of them. We started from physical health education, physical education, health education, and a lot of them. So today we will continue and see how far we can go. You said what? Okay. I can see new faces, and it looks as if most of the people that were here in the last class are not even here.
Yes.
Majority are new faces. Okay, now. Let's be consistent in what you are doing now. Let's be what? Consistent. All right. I just want to say one or two things before I continue. Please, if you are not in the group, please make sure that you are in the WhatsApp group, and make sure that you are in the WhatsApp group, and you are also in the Telegram group. Ensure you are there and ask questions. Your assistant class rep or your class rep, look for a way to, for now you cannot. I will still move you to channel, because I think it's a channel that you can actually see older information. But for now, you can be sending new from the Telegram group to your personal group, not the group I have with you people. And for the new I have people, make sure that you are there, because that is where I'm going to post the quiz for today by 1 p.m. Is it by 1 p.m.? Yes, it's 1 p.m. No, 1:30 p.m. The quiz we have by 1:30 p.m. So, let me say one or two things about the quiz. My quiz is not compulsory. You must not write it. If you think that you are not ready for it, don't write. Just go. Don't write. But before the exam, I'll bring that one day. So if you miss 20 quizzes that day, you must finish all the quizzes that day. Even if you go by 10 p.m., I don't care. You must finish that quiz that day. Because if you fail to write it that day, what you will see in your CA is 0. There's no truth about that. So you see that it's not left for you to weigh your options. State your what priorities, set your priorities right. Ask yourself, this quiz I'm about to miss, is it what I'm going to do? What will make me to miss this quiz? Is it that important that it will make me to miss the quiz? So I push it back to you to take that what decision. So if you like, don't write quiz every Monday, every Wednesday. I must be quiz until the semester ends. So if you check how many weeks we have for the semester, and we do up to 10 quizzes, that day you must finish all of them. Am I communicating?
Yes, sir.
So I said, let inform you so that you know what you are doing. But I will advise you writing it as it comes will help you more than waiting for the last day. Because that last day you don't even know what will happen. And if you miss it, you're on your own. Because I've tried. You are on your what? Own. I will not listen to you. In the column of your quizzes, you see 0 there. So make your choices. Where is the crash step? Please, can someone? I can't have access to the materials. Can someone help me with his or her phone? Those that have good phones, so not
This one.
leave her alone now. What did she do to you?
This one.
Okay, you have phone, but you don't have a battery. Who can help me with good phone? Phone with both phone and battery, not only phone alone. Just open that Telegram this and give me. Let me. Okay, your phone is in your bag. Okay, give me. And let me repeat myself again. Please try as much as possible. Open that material in the Telegram. Please, I want to advise again. Ensure as I'm dropping the material, that thing is notes. I don't give handouts. What I give is under normal circumstances, I'll just come here, teach, dictate, you write. I told you in our last class, but I decided to be posting it there. So it's the same thing. All you need to do is just once you see it, copy it in your what? In your notes. It will help you more. Am I communicating? Oh, how many seconds does it take to be locked before it locks? How many seconds does the phone take? 1 minute. Okay. That means I should be tapping it. Okay. Hello, are we together? Now let's continue from where we stopped. Someone said that we stopped at attitude. Have we discussed attitude?
No.
Okay, so we start from attitude, right? Do you know why I'm defining why we are defining the distance? Sometimes some of these words may not be exactly as you know it in the English language. They are with respect to health, what education. Am I communicating? So that's why we are defining. If not, no need, because this most of them are words you have encountered, but some of them may not be exactly the same as you see it in your dictionary. So please permit me to help me put this in flight mode so I don't get distracted. Thank you. Okay, so let's. You're making noise, you, and sit well. Attitude. So what is attitude? Basically, attitude talks about what? Essence, what? Feelings, thoughts, and what? Behaviors towards a particular thing. or concept or situation or even fellow what human being, am I communicating? Is the one you see in person's actions or behavior, even though at least you notice someone's behavior, right? But the person's it doesn't have to do with the person's what feelings. Am I communicating? Yes. So the attitude you show starts from your what? Your feelings and your what? Thought. Am I communicating? So when we say I'm used to her own. Give me her own. At least I am with her password. It's not our phone, she? Yes. I'm with her password, so it's our phone. I know you may not want to give me your password. And she laughs. Okay, so attitude starts from where? Thoughts, feelings, then you what? And your behavior. Okay, you think attitude is only about behavior? No. It includes your thoughts, your feelings, and your behavior towards maybe a situation, a thing, or another what? Person. That's what attitude is what all about. Are we together? Yes. Good. So we look at the next one. We look at the next term. Say what? No, it's not factors. There are other terms. There are other terms. So we look at the next one is interest. We look at interest. So if you have not come across interest by now, that means you have not really know. You have already started having issues. We have interest. Interest is there. So what is interest? Interest mean different things in different words. Interest in accounting, is it interest in, is that interest in accounting or whatever? Is it the same thing with as interest in normal interest, Eh? Good. So interest. So here now, remember we are talking about health education. We are talking about the 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 educator and the learner. The educator and the what? And the what? Learner. So here now, in education, when we say interest, we mean the learner's desire, to learn about a particular health or topic or issue. Before you can be a good educator, you must first of all consider the interest of the what of the learners. If the interest of the learner is not there, you are wasting your time. So the first thing to do is to stimulate the interest of the learner in the topic you want to do or talk about. So you must stimulate their interest. So health educators aim to spark, you can call it spark or stimulate the interest of the learners. So to encourage them to learn more how their healthy behaviors and practices. Remember, the ultimate goal is for them to learn about their healthy behaviors. Am I communicating? Positive health behavior that will help them to be healthy and live well. Am I communicating? So that is the primary goal. So no matter the topic you are talking about, try as much as possible to stimulate their interest. You can't just come and start talking. You're wasting you may end up wasting your time. You may even end up annoying them. You may even end up annoying the learners or the audience. What are you doing? Where is your pen? Where is your book? Is that how you should sit? Sit well. You are in class. Put your leg here. You are in class. Like this. Then put it well. You small leg. See her own. Stay well. Or open your book and start writing. You are in class. You must not write down for note. As I'm talking, you can be putting down something. Or open your notebook. Be a student. You have no business with here. Listen to what I say and make note from what I say. After you can go home and do what? Look at this. That's how to be in class. Were you not taught about note taking? Have you started doing English? Have you started doing English? Okay. Note taking in class, you should know how to take notes in class. When the lecture is going on, you should be with your pen and your notebook. As the lecturer is speaking, is teaching, there are one or two things you can put down. It shows that you are flowing, that you are following the lecture, that you understand what lecturer is saying. How can you be in class and you are just you are even in front? See this one. You okay, I did not see you, right? I saw you and I heard you clearly. Don't say you are not talking. Okay, you are talking to yourself. Maybe she was soliloquizing. Huh? Let's be students. We are students. So, I said that the ultimate goal is for them to learn about healthy behaviors, so as to live what? Well. I'm not communicating. I live healthy. So interest matters. Interest matters. It's very important. So the next one is what? The next term is participation. The next term is participation. Because it's when you stimulate or spark someone's interest in a particular topic, that's what the person will do what? Participate. True of us. So what is participation with respect to health? It talks about the active engagement of learners in the learning processes. That is when you now spark the interest, that's when they will now actively in the process. Am I completing? Good. So it talks about what? Active engagement of the learners in the learning what? Processes. Then what are the active engagement? Have you not seen? Are you aware that I have I have I have sparked this her interest now in what we are doing. Before she was just like this, gisting, laughing. But I have pushed her now. She has opened her pen and opened her book and she's doing something. The interest is now coming up now. And with time, how will I know that I have actively engaged her now? Watch. The next step now is you should start asking questions. Yes, because she's now beginning to follow. True of us? Good. That's why we are educators. Now, so what shows active engagement? The first one is what? Activities like discussion. She may start in what? I use her as our point of contact in our case study in our today's class. Now, she may start doing what? Engaging in the discussion. I may bring up a discussion now on this topic, on the topic that we are talking about. She may now start, participating in the what? Discussion. And if it is something that you may need to play one or two roles, she may start playing a role in what? The conversation. Sometimes it may also be hands-on practice. Do you know what is hands-on practice? There are some training here that you need to really use your hand to be able to participate. You may need to on how to use the computer to do one or two things. She may start, practicing it as lecture work is going on. Am I communicating? What's your name? What's your name? Yeah?
Ore.
Yeah?
Ore.
What's her name?
Ore.
Ore. O-R-E. Ore. Okay. Okay, ore is where from ore.
Yes. Ore is a town. Why Ore is the name of
But do they mean the same? Do they mean the same thing? Do they mean the same thing? I don't. No, I know that it sounds different, but do they mean the same thing? No, they don't mean the same. All right, let's continue. Hello, are we together? All right, let's continue. Now, the next one now is comprehension. Let's look at the next term, comprehension. Comprehension. So, what is comprehension? In health education, when we talk of comprehension, we are talking about the learner's ability to understand and interpret health information. With respect to health education now, when we talk about comprehension, we talk about the learner's what? Learner's ability to understand and interpret health information. Someone that did not indicate interest and did not participate, can the person comprehend? Eh? Someone that did not indicate interest and did not participate, can the person comprehend? The person cannot comprehend, right? Yes. So it's a chain reaction. True or false? This will lead to this. This will lead to this. Have you seen the chain reaction that this is chain reaction that will continue until somebody fails exam? Are we together? This is the chain reaction that leads to exam failure. First, you are not interested. You come to class anytime you like. You do what you like. Secondly, you're not participating. Now, when you think that at the end of the six semester, you now read everything and understand, you don't understand. You may cram. After cramming, you may forget what you cram, and you may carry it, and they will catch you. You'll be expelled. You know, it's a chain what reaction. Start from day one and participate in whatever that is happening. Are we together?
Yes, sir.
Are we together? So now let's throw more light on the comprehension. Are we together? So the health educators, the aim of the health educators, the aim is actually to promote comprehension. And how will the health educators promote comprehension? By using clear and simple language. Clear and what? Simple language. And also by using visual aids. Clear and simple language. Am I blowing? Am I blowing big grammar here now? Am I using big medical terminologies? This is simple, clear and simple language. You know. Am I communicating? At the same time, using visual aids, and that's why I record our lectures. After each lecture, I'll post you the link. For those that know what I'm doing, you try as much as possible to watch it, to help you to understand. If you watch it over and over again, you understand what it will sink well for you. Am I communicating? It will sink better than just that once we did it in class, and sometimes have you been here? We have other things. Some things can be projected here. You watch it. You watch those clips. It aids understanding. We call them what? Visual aids or audio visual aids. Am I communicating? So these things help to do what? Encourage what? Understanding. And also they also use other teaching strategies, different teaching strategies to make the students, the learners understand and follow. Are we together?
Yes.
To help the learners follow. Now, the next term I want us to look at is motivation. If you have no interest and you did not participate and you did not understand anything, do you think you motivated to change your bad health behavior? You will not. It's only when you understand by understand, I mean seeing the need for you to change the bad behavior, the bad health behavior. That's when you're motivated to do more, even if you start finding it difficult, because some may not be easy. Am I competent? Like just like a chronic smoker, someone that is a smoker, and you think you come to the person today, or you be able to have an audience of smokers, and you started a program with them, a program of smoking cessation. You start, maybe you think if you start a program of about smoking cessation today with an audience or group of chronic smokers, you think just that one day they will change? Bam! No. If you say, you may even talk for 5 hours that day. Some greater percentage itself may not even have interest. Some may even say, is it why he called us here? Is it why he's here? Huh? So all this now, getting to the level of motivation, the person must first of all understand what they are saying and understand the implication. Accept it before you think of getting motivated to do something. And even when the person is motivated, the person may try along the way. The person may get discouraged and fall back to where he started and continue again. So it's not an easy task. So the point I'm making is that motivation is important. So in higher education, when we talk about motivation, we talk about learners' desire to adopt. We talk about the learner's desire to adopt healthy behaviors and practices. In health education, when we talk about motivation, we talk about the learner's desire to adopt healthy behaviors and practices. Are we together? Healthy behaviors and practices. So what do we aim here? The health educators here aim to motivate the learners by highlighting the benefits of healthy behaviors. You must always talk about the benefits, what they stand to gain if they adopt healthy behaviors. That will motivate them. True of us, yes. It do motivate them. Now, not just that, they motivate them by providing positive reinforcement and encouraging social support. Social support. Try as much as possible. With time, we go into all these things. Remember, this is just we are just defining terms, and I'm even going deep into all this. But it's good. We understand them. It's good we do we understand them. Are we together? The next term is behavior. Behavior. If you ask now what is behavior, what do you understand by the term behavior? Behavior is what?
One's habit.
Huh? One's habit is behavior. Is it true? What is behavior?
The attitude that a particular person is adapt with.
Attitude.
Yes.
Okay. Who else? Oga, what is behavior? You. How someone acts. Auntie, what is behavior? You. Behave. The way someone behave. Okay. Okay. I thought you said the way someone behaves. Okay. React. Act. React. Who has another? The way someone acts towards others. Madam. Madam Nose Mask, oh yeah. What is behavior? Tell us.
Behavior is the way in which an individual exhibits or reacts to
React, act. Okay. Okay. All right. So at least you guys have the idea of what they're talking about. Yeah. So now, what when we talk about behavior, that's on a general term. But if you come down to health education, when we talk about when you hear behavior in health education, we talk about the actions and habits, action and habit that an individual exhibits with respect to health. Altogether, action and habit an individual exhibits with respect to what? Health. For example, now there are human beings here. They come back, and people say in school, here in the class, their neighbor is eating fried potato or yam. Here in the class, they just put their hand, bam, and take one and eat. The person's action and habits towards his or her health, is it good? Is it a good behavior? Huh? Hey. You know what I said? I love it. Okay, let me say it again. I said class, maybe you are eating potato fried, maybe the aroma is something else, well garnished sauce, and look at that human being here, she just rush. Maybe she went to the toilet, had to mop to clean, and now who cleaned the board for us? She cleaned the board, she touched all these chemicals, or after everything, she used her hand clean, and she someone that even clean his or her nose, washing her hand, and she all those things she collected, she just rush and take one plantain, a cut of plantain or potato, and start eating. That action, habits towards health, both her health and the health of the person, is it good or bad? It's a very bad health behavior. It's a very bad what? Health behavior. It's an unhealthy behavior. So it's a bad health behavior. Am I communicating? So that's what when we talk about behavior in health education, we talk about someone's action and habit with respect to what? Health. Am I communicating? But I don't think he just said, please keep for me, don't finish it. She rushed and washed her hand with soap and come back and take. Is it a good health behavior or a bad health behavior? Am I communicating? Is smoking a good health behavior? No. Is a bad health behavior? Am I communicating? So that's what we mean by what? Behavior. With respect to what? Health. So the aim of health education is to change their bad health to what? Behavior, and start acting in a way that is positive. Positive, we call it positive health what? Behavior. Am I communicating? That is so, because if you have a positive behavior, you will resist. You prevent disease, and you even be present what? Disease. Am I communicating? Yes. I'm ready for what? Spreading. Now, so that's what we mean by what? I thought I was of health educators in is to ensure that we promote positive health what? Behaviors. I've said that. Behavior is to ensure that we promote positive health what? Behaviors. So what are those positive health behaviors? Talk about regular exercise, right? Regular what? Exercise is a positive health what? Behavior. Three of us, regular what? Exercise. Healthy eating. I think I've talked about this in our last class. Healthy what? Eating.
Yes, I need example.
Eating healthy. Eating healthy is also a positive what? Health what? Behavior. Trust. Then stress manage everything that will give you stress. Manage your stress. Am I communicating? Yes. Because if you eat the talks, are you aware? Your BP, all those things, those ones are there too. I hear people saying that malaria is stress. Have you heard someone people what does how does he what business does he have with malaria? It's only malaria, right? It's plasmodium. Yes, infected mosquito, right? We as when it's trying to suck blood, it will inject the plasmodium, right? But then how what business does has stress to do with what? What time that the immune system goes down? I remember typically normal here normal area is normal. If I go to lab and do my and carry out malaria test, I must see plasmodium. It may not be clinical malaria, but I must see plasmodium. It is rare. If I carry out now malaria test here now, MPS here, great percentage will have plasmodium in their blood. They may not have clinical malaria because, but when their immune system comes down, it do what? Surface. Am I communicating? So that's what stress can do. It can bring down your immune system and you fall sick. And people that pass through stress fall sick easily, especially the sickness that have infection, because their immune system will automatically go down. So if you are through one stress or the other, maybe because of the nature of your job or whatever, please ensure that you take enough. That's why it's good to take enough fruits, vegetable, enough water, all those things to help you to do what? Boost your what? Immune system. What are these human beings they're discussing? What I say now, what I say now. Tell us.
We're talking about infection and the immune system.
What I say about it? Tell us what I said about it.
You said that.
Tell us.
Talking about stress can affect you.
How?
How? You can really.
How is stress affecting us? What relationship between stress and malaria?
So you said
Another.
stress causes BP. Yes.
Cause what?
BP.
BP.
People also have right.
How is stress cause?
Like you're stressing yourself, your BP will rise. And everything's affecting your immune system. Yes.
How? And so what? You are trying to defend yourself, but you are not listening to me. You cannot link them now because you are discussing. Why are you come here? Carry a book and come here fast. Is there anybody here?
No.
Carry a book and come here. Come here. Fast. Yes. Sit here fast. You soon come here. I don't know what you are looking at the back. You are in front. Manage where you are. You don't go to the back. Are we together? You stay where you are. Where you are not, we will be pushing you to go. Manage where you are. There are nothing good, wonderful there. Manage here is good. Stay there. Be contented with this place. Hello. So now let's look at next one. Diagnosis. So what is diagnosis? This one is common, right? So what if you hear diagnosis, what comes to your mind? Oh yeah, answer you answer now. Oh yeah. Okay.
The patient is just not used to the hospital and is stressed and they give hands to lab to make a test. So whether this is actually typhoid or manual, so that's what I do.
Okay. What answer by them that?
Diagnosis is as it is a way.
Look at this one. You said it again here. No. Tosi, don't allow her to put you into trouble. No. In less than 5 minutes, she said that again.
Diagnosis is a way or a process to
Identify,
a particular problem or symptoms or to identify a particular problem, maybe in the human system or diagnosis.
okay, to identify a problem in the system, in maybe the human system. Okay, any other idea?
Of an illness or other problem.
Eh?
The nature of an
The
illness.
what? I'm asking what is the diagnosis? She said that. He said what?
The diagnosis is the nature of an illness
Nature of an illness.
or other problems.
Who else? Any other idea? Tell us, ma. Identify. What is diagnosis?
Tell doctor.
What is diagnosis? What is answered by the term the diagnosis?
Diagnose that to identify a particular illness or sickness.
And she's intelligent too. She's good too. What's your problem? What is the color of your issue? To identify. Okay. Now, basically, on the general term, once you hear the diagnosis, you are trying to find out that identify maybe something, problem, a cause of something. Am I communicating? Or basically to identify a problem. Okay, but bringing it here in health education, we talk about it's a process of identifying, not just to identify. You identify and determine the nature. Am I communicating now? It's not just identifying. It's to identify and determine the nature of health what problem or issue. Are we together? So diagnosis in health education refers to the process of identifying and determining the nature of health what problem. Or do you know why it doesn't stop at level of identifying? Because the purpose of diagnosis is to take care of it, true of us. And if you don't understand the nature, you cannot treat it, true of us. True of us. You can only take care of, eliminate or treat something you know the nature. You know how it looks like, what it looks like. It's not just identify it. You go a step deeper, determining the nature of the health problem or the issue. So that's what diagnosis is all about. It talks about the process of identifying and determining the nature of the health problem or issue. Okay, so now is from where your own definition started. When you now want to go into the process, how do you now identify these things? That's when you start looking at the techniques. Some may be just to clash and give to say it's not definitive, but some will go further to go to lab using laboratory or techniques to test another test. So now, so what is now left for the educators to do? The health educators may, at this point, use diagnostic what techniques. It can be what health assessment, as I said before now, health assessment, assess the patient by mere discussion, look at the patient, be able to say, okay, this is happening to the patient, this is what it should be. Am I concluded? Or using screening, health what? Screening. Am I communicating? Of course, screening is a general term that involve checking the what? Checking the whole body. Am I communicating? Checking the what? The whole body. There are those that are you use wet lab. You go to the lab, you get samples and use wet lab bench to be able to do that. There are some that will use quantum this resonance stuff. Have you seen that one? That one you call computer lab. That one employ quantum machines. Am I communicating? Where they will now use it to assess. There's nothing like taking your sample and going into that one thing with that one will help. Like how some people will just go, they will assess the entire system. Do you know what that one does? That one will, if you develop heart issues in the next 5 years, it will tell you. You see the indicators that the potentials for developing such thing in in some time to come. It's not left for you to modify your health behavior, so you can start living healthy to prevent it from happening. Am I communicating? What you do, you just see greater indicators that it's about to happen. So it's always good when you go back, it will assess the entire system from head to toe, the entire system, and give you a report of what is going on in your system, every part of your body. All the system you open, any system you open, it will show you what is happening or what's about to happen. So it's not left for you. Sometimes it may indicate that something that has to do with BP. You may go and check your BP. It may not be high. You may not be high at that point in time. But if you don't change your behavior, it will not get up to 2 years. You develop high blood pressure. Am I communicating? That one, it doesn't fail. So if you ever say so, that is good. It will help you to monitor, to know how you live your life. Am I communicating? So that's so. But it's always good to combine the two of them. After going for this, maybe if you now want to be purely definitive, to know whether it's happening now and how it's going on, what's actually happening. You still do wet lab stuff, but that one will help you to guide you on how you live your life. That's why we categorize it under just health screening. We call it health screening. Am I communicating? Not that you go there and there's an indication that you have BP. Don't make that mistake. Maybe some pharmacies have it. I think some people, if some private clinic have it. If you go there and there's an indication that BP, something indicating cardiovascular, blood pressure, from there, boom, you disappear and go and start taking antihypertensive. You will die. You will develop low BP. You should, first of all, after that, it has told you something. Go back, do further test. Am I communicating? Check use normal stethoscope again. Check your BP. Check other things. Maybe you go there, there's an indication of liver issues. Don't go boom and start taking liver issues. Try to carry out wet lab testing to be sure. You may not see anything in the lab. You may not see anything. Even if you don't see anything, don't relax and say they are lying. No, they're not lying. That is not lying. There's something, it has since indicated of what start to happen to you there. Maybe the nature of the cells there. Are you aware that there's what is called, are you aware of Sub, 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 sub health. Have you heard of that term? Someone should check it and tell us what this sub subhead is what?
The transitional state between health and illness, where a person may experience physical, mental,
Wait, just
symptoms.
let's listen to her. It's what?
Is a traditional state between health and illness, where a person may experience physical, mental, and social symptoms without a clear diagnosis.
Have you seen it now? Okay, another one. Subhead.
It's time used to describe a state
Wait.
of being.
Huh?
A state of being that is below optimal health,
Okay.
but not necessarily meeting the criteria for a diagnosable disease or condition.
Good. Are you pointing us to something now? Link subhead now to what I said about all those all those quantum distance. What is that by subhead? Who can tell us what you understand by subhead? Okay.
It is a period between you're in good health,
Okay.
and then there is this period in which it has been predicted that
Okay.
it is you are transitioning into that bad health. For example, sorry, what I stand by is this person has been diagnosed of cardiovascular problems in the future, but
Okay.
yet he's still okay.
Okay.
So the period between
Transition.
okay and then
Good. And it's a very, very serious level, serious time that you need to be careful. That's what most of these things dictate. Most of these quantum disease, that's what they did. That's what they dictate. Some health is a transition between healthy states and ill health. Is a transition stage between healthy states and ill health. That you may even go to lab, you won't see anything. Am I correct? That tell us sometimes you may go for all this quantum resonance when you are done with it and go to lab, you will not see anything. But if you don't change your health, if you don't adopt positive health behavior, with time, because it is a transition thing, it will move towards ill health. But if you're able to detect it and work towards it and start modifying your health behaviors, you may reverse that transition and go back to what? Healthy state. Am I getting? So when you go for all these things and they are pointing cardiovascular system, that something is wrong there. Pointing your liver, your kidney, there is something is going on there. But you may go and do kidney function test, you will not see anything. You may do liver function test, you will not see anything. And if you relax and continue your unhealthy lifestyle, smoking, drinking, doing nonsense, it will manifest. Before you start seeing it in the lab, a lot of damages has even taken place. Are you aware? So sub-health is a delicate stage. So that's what most of all this one you call computer detects. They detect this, but what lab may not. Am I getting? So there are other things surrounding this subhead. Let us not go deep into that. Okay, I just use it to explain something. Now the next one we have been before now. So let's not go there again. Let's look at personal health. Personal health. What is personal health? From the term personal is clear. So let us not waste our time there. So personal, when we talk of personal health in health education, we talk about an individual's health and wellness. An individual's what? Health and what? Wellness. An individual's health and what? Wellness. And to be more distinct, put an individual's overall better. An individual's what? Overall what? Health and what? Wellness. So when we talk of an individual, it's just the same thing with health, but this one now is now an individual, personal now. When we talk about overall, we talk about normal one we know, both physical, mental and what? Social what? Social or an emotional what? Well-being or health. Are we together? Are we together? Now, so health educators also aim at promoting personal health. Health educators also aim at promoting what? Personal health. And how do we do that? We do that by teaching individuals about healthy what? Behaviors. Like now, with time now, if I have chance now, I will start going out, going to Sunday school, tell them about their health, booking session with different schools. Who would like to go with me? Raise your hand. Everyone want to go with me. You can just go speak to them some things about adopting healthy what? Lifestyle. Am I competing? So it's a very good thing to do. You are helping people to grow, to learn about their work. And they are this thing they say prevention is better than what? Cure. Most people develop or one disease, one illness, or fall into it out of ignorance. Yes, out of what? Ignorance. Majority of people out of ignorance. There are some that know, that are aware of implication, but they say maybe how sweet that lifestyle is to them. They will continue through of us and still end up what? Developing the disease as a consequence of that healthy what? Life. That is it healthy lifestyle? That unhealthy what? Lifestyle. Tell me an example of a situation whereby someone is aware of the implication of this particular that this lifestyle is not good because of how sweet he thinks that lifestyle is. He continues enjoying that lifestyle until he develops this. Example. Another one. Drinking. Another one. Liver issues for drinking, right? You know, smoke in another world. Get that feelings, right? Drink alcoholics. Don't even go there. Another one. Prostitution. Hello. All right, now let's look at another one. Okay, so what do we need to teach the people, the learners to know about their personal health? We'll talk about teaching them about healthy behaviors, stress management. People neglect stress management. It's a very, very aspect of health. Hey, a lot of issues, a lot of diseases, both chronic and acute, as a result of what? Stress. So we should learn how to manage our works well. So the next one is what? Self what? Care. Of course, now if you are conscious of self care, you know how to manage your stress. True of us, and you run away from things that will give you unnecessary what? Stress. Now the next one I want us to look at is disease. What are diseases? What is a disease? Who knows? What does that term disease? Tell us. Tell us. Tell us. Good. I want her to tell us. No, you know, say it. Say that in your mind. You are expressing your that type. Really, I mentioned it. Oh yeah. Tell us. Okay, you remember it. Okay. Who knows? Huh? Uh, I said I didn't say look at the customer. I said tell me what you understand by the term. What do you think? Is what? Tell us what do you understand? Since your partner left, you've been quiet. Tell us. What that is? What do you understand by the term disease? That does what? That does what? Huh? Huh?
The disease is a condition that affects or harms the normal function of the body.
Good. I like that. I like that. Good too. Nice one. Nice one. Nice one. Mm. So she's not even the problem. You are the problem. And I just, took an innocent. I'm sorry. She is the problem. Now let's look at diseases. So in health education, diseases are simply what conditions or illnesses. You got it right anyway. That affect individuals' health and wellness. Am I communicating? Am I communicating? They are what conditions or illness that affect individuals' health and wellness. So how do they affect individual wellness? Is it positive or negatively? So you can actually put negatively affect, right? You can add negatively affect what? Yes, you can add what? Negatively affect what? Individual. Individual what? Health and what? Wellness. Are we together? Are we together? Yes. Good. Now, so the aim of educators in educating people is to prevent and manage what? Diseases. Am I communicating? Yes. Very important. To prevent and manage what? Diseases. The first time I did that thing, the first time I went to I organized health talk. I just on my own left my house. One of my mentees, I just call her, come. No, him, come, you take me to somewhere. I just went to that school, one secondary school. The first time I did that, I went for this health talk. I just called one of my mentees. We went to the one secondary school like that. Spoke to the principal that we want to go. I said, okay, they got the students. We just spoke to them. Then after that, we thanked them. As we were about to leave, from nowhere, one envelope with cool money inside it in appreciation. I was like, sure. I was like, no, I just on my own. I just decided let me just go and talk to these people, different topics about promoting health. That's all. I say, sure. That is what. No, the point there is that see, a lot of people want this information. Am I communicating? People perish because of lack of what? Knowledge. People make mistakes. There are some people in the hospital today. If you visit them, they will tell you, if I had known about this, I wouldn't have ended on this. If I had known, if someone had, it doesn't end in establishing hospital, private hospitals everywhere, waiting for them to fall before you start treating. No, as a health professional, you can take it upon yourself. The little one you know, so but don't go and give nonsense, useless information that will even cause issues for them. But you can go. You don't wait for them at the goal post to get to their. There are some things talks like this can help to solve. Am I communicating? Yes. So the health educators aim to prevent and manage what? Diseases. So how do we prevent and manage diseases? We do that by teaching individuals about risk what? Factors. Risk what? Factors that can expose them to what? That such what? Disease. Two of us. And that's exactly what I went to that school to do. The students were so happy. In fact, because the school where I was living that time, the school is not as far from where I was. Since that day, anywhere any of those students see me, they'll be like, sir, you see joy, you see happiness. I don't know all of them, but anyway they see me at that time, even now, some of them still contact me for one thing or the other. All those things are very important. They are very what? Important. That's why it's not just about hanging yourself in like me now as in one party, collecting their money, buying drug, adding money, and making my profit. It doesn't end there. You reach out. That's why sometimes you see people organizing outreach. Reach out to people, especially promoting health. That's the most important. The first step to promote health is vital. Because if you promote health, then people will take responsibility of their own health. Then, of course, now you can never have a perfect system. One mistake or the other, or some that may be as in there are nothing you can do about it. Maybe because of the environment and they get exposed to to some disease. That one is different. But there are some things that are preventable. True of us, yes. There are things that are what? Preventable. So we do that by teaching individuals about risk factors, symptoms, and treatment what? Options. Symptoms and what? Treatment what? Options. Now let's look at what are you doing?
I'm writing.
What are you writing?
I start to do this.
What Hey, please let our attention be here. So some things I'm saying are not in that paper, are not in that material. Some things I'm saying, and these are the things you hold your pen and put down. It's not everything is in the lecture note. If you put it in lecture note, you cannot finish it this semester. True of us. But as I explained, there are some instances I will be giving that are not in. Oh yeah, come here. You come. Come and sit here. Fast. So let's look at the next term. Next term, saturation or assistant. Their cup is overflowing. Now, see it.
You say teaching individual.
Huh? Is that what?
Teaching individual.
About risk factors now. Risk factors, symptoms, and treatment options. These factors are those factors that will expose them to a particular disease, right? Then for those that have already have the disease, you start talking about what? Symptoms and treatment options. Am I communicating? These are what you will educate them on, so that in case they start noticing the symptoms, they will know exactly that there's high tendency that have contracted this disease. True of us. Yes. If you know about the symptoms, when you start seeing it, you will be able to say, okay, it's possible. Let me go for test too and be sure. Am I communicating? Or let me see a physician. If you know about your symptoms well, that's when a physician can ask you, how do you feel? What and what? That way you can explain it better. True of us. True of us. Yes. Now, sanitation. So, with respect to health education, what do you understand by the term sanitation? Tell us, what is sanitation?
Sanitation.
Mm. Is what? Cleanliness.
Like the act of cleaning your environment. That's sanitation.
Act of cleaning your environment.
Practicing it. Practicing cleanliness.
More coming out. What else? What else did you want to add now? I add. she's intelligent, but intelligent alone cannot take you far. Your attitude towards a lot of things will take you far. You are in class, you put the right attitude to class. You know, sometimes that's how intelligent you will be. You may even make mistakes because you will not be open to new things. That thing you know or you feel you know will be blocking you because you will not feel empty. The moment you feel empty, make yourself, even though you intentionally make yourself to feel that emptiness of learning more. You see yourself learning more because you put up the how do I put it now? You that posture that will make you to learn more. You go far. More easy to do what? To learn more. Am I communicating? So that's the issues most people that are highly intelligent have sometimes. And I know what I've seen a lot of intelligent people that stop somewhere. They couldn't go because there's this, they know they're intelligent. Even if you know you're intelligent, calm down. Always feel empty to know more. In a class like this, you put everything possible, remove every distraction by your side, so that because that human being standing here, there's a reason why there's something in him you want to grab. So you give all your emotional attention to grab that thing. If somebody is here teaching, talking, and one simple interaction you had, you have missed something. You think that you're following, but you're not. But because you're intelligent, your mom will tell you that one after I read the material now. No, it doesn't end in reading material. What to make is not just the personal experiences we are sharing with you here as your lecturers, as your formators. You will miss. You limit yourself to reading materials, and most material you see are summaries. Who is losing? You are losing. Am I communicating? Yes. So please, let's put that into what? Consideration. It's very important. I'll share a lot of life experiences with you here now. But someone that is not here has missed that one. That's why you come to school. If these things are not necessary, you stay in your house, you send in the material, you read and write exam, and you pass. Three of us, you pass. But you're different from someone that sit down with a mentor. That's what you call mentorship now. It's not just about reading material, sharing personal experience with you. You cannot sit in any book in this world unless I sit down and put it down. Maybe I may sit down one day, all the things I'll be talking, I will sit down one day and gather all my lecture videos and develop a material of my. Some of the things I say, I didn't plan to talk about them here, but because as lecture is flowing, I'll start connecting where I did something that has to do with what we are discussing. I'll bring it in. If you miss it, you have missed it. Are we together? You get the point now? Good. Now let's continue. That's why if I'm in a class, I don't joke. I may not, once That's why I don't like lecture that come together and be talking about their notes. No. I want to, there's something you know that made you've been working, you've been teaching, you've been in the field for like 10 years. There's something you know I want to hear you talk about it, personal experience. That's what I listen to in lectures. And whenever I'm in lecture, that's why I hold my pen. These are the things I put down. If possible, record it. Because I may not be able to see it any other place. You can't see it any place. I said the person put it down. Two of us. All right. So now, sanitation in health education talks about the practices and facilities. The practices and facilities that promote cleanliness and hygiene. It talks about the what? Practices and what? And what? Facilities that promote what? And what? And hygiene. So anytime we are talking about, it can be a facility, it can be the practice, once it gears towards promoting cleanliness and hygiene, you are talking about what? Sanitation. Are we together? Now, so as health educators, what is our aim here now? The aim here is to promote sanitation through different means. I talked about hand washing here, right? Yes. I talked about hand washing. So you teach individuals about proper what? Not just hand washing. You know hand washing. Go and wash your hand. Put down a wood and come and know. Proper what? Hand. I think I said this in our last lecture. That that a lot of people learned how to properly wash their hands during that COVID-19. Are you together? Before then, a lot of people didn't even know how to wash their hands. How many minutes were recommended that you come down and wash your hands? You have forgotten. That means you don't wash your hand properly since then. You will think it has gone. even though that was a pandemic, but it can come back anytime. Hope you know. Okay, God. Okay. So was there no God when he came? God cannot do for you what you can do for yourself. God has given you the wisdom, the brain, the mind, everything. You don't need him to do anything for you again. Use your number 6 to know what you should do. That's one thing with God. He cannot even do for you what you cannot do. God starts acting where your strength fails. But he will allow you to exercise that strength he gave you. He cannot come and start. No. God doesn't work like that. Lie. That's why you see those that think that they pray. They are still poor. If you don't practice the act of managing, you'll be poor. Even if they give you the whole money in the world, you still be poor, bro. True of us? True. It's true. If I give you 20 million today, by 1 week you still be poor. If you don't know how to do what? Manage and how to invest and use money. God doesn't need to come down and do that for you. He has given you the mind, the sense, the brain, the opportunities, the privilege to interact, to learn how to do all those things. Am I communicating? So let's get that. So God that kept quiet when it happened can still keep quiet if we don't prevent it from spreading. All right, so let's look at what. Okay, sorry. So how do apart from the teaching individual about proper what? Stand up. Walk around the class. It's not you. The person I'm talking to knows. So now we promote this by what? Healthy work, by proper what? Hand washing, waste disposal. Some of you, we talk about waste disposal. You think it's that one we see on the road that they park. Some of you here are culprits of this nonsense. You drink pure water, boom. Even in this class, some eat, boom, eat, boom. You eat banana, boom. I don't know human beings in the school of health that threw this pure water sachet on the compound. Tomorrow you come out and wear beautiful clothes that you want to go and promote health. Let me catch you. See, pure water, see. That's the that put the water. Breathe from where it's not true. What am I saying? Start now. On a more serious note, I yes. See, that's what I want. By the special grace of God, I have actually conquered that one in a way. A life with time. In life, you need to look at yourself and look at some habits. Are we together? That's what you. Hey, what's going on there? As you are, take one habit one by one. You cannot conquer everything the same day. Take one, tell yourself, I want to conquer this so time. I've conquered this nonsense by God's grace. Even if I'm somewhere, I eat biscuits when I was eating biscuit too, or maybe I drink water or something. Unconsciously, sometimes I won't even know when I fold it and put it in my pocket. I won't even know. I won't know. To throw it away, I don't remember that they throw it away again. I won't know when I put it. Maybe when I get home, I will now notice that something is in my pocket. It's water I drank somewhere. Maybe because I did not see a waste bin. But there are people that unconsciously see it, they don't even know what they do. They have a food. Tell yourself today, I want to conquer this habit first. Start from there. And you practice it. It's good. So we cannot be talking about waste. When they say waste disposal, and I know your mind will go to that one outside. Let us say you are wasting your time. Start. You see you as a discourse. Start from the one you are doing here, first of all, on your own. There are some in this class, they will just enter. Boom. See, look at this place here. Look at this place. Look at this place. Tell me what you see. Is there? Certain water, biscuits, banana pay, nonsense. These are people we are training. I wonder what they tell people. So we are talking about what? Sanitation. We are talking about what? Sanitation. So waste what? Disposal. Of course, waste disposal and what? Environmental health. Of course, if you dispose waste properly, at least environmental health will be somehow better. True of us? Yes. Then another one is other one that maybe that has to do with air pollution and other things. And most of these things, in fact, you just go outside. I wonder how do people even do all these things? If you look at the drainage system, before you see a human being with pack dustbin, waste bin, and go to the drainage system and pour here conveniently and go back. Tomorrow, you know where the rain stops, the thing will stop there. So then tomorrow, maybe as you pour your own, the floor will carry it and stop in another person's. Then others will pour their own somewhere and they'll stop in front of your, and you start shouting, hey, maybe this is dirty, this state is dirty. Are you okay? Are you normal? This state is dirty. State. Who is the state? So charity begins at home. So that's this can also form. This can be a topic about sanitation, because you catch them young, go to secondary school, primary school, tell them why. You see, they will start even at that level. They start practicing proper disposal of what they from there. You don't know the multiplier effects of these things, what it can do in the society. Am I communicating? Apart from them knowing that it's good to dispose waste properly, it also helps the environment to be what sanitized and reduce disease spread and other things. Am I communicating? So these things are very important. Now the last one I want us to talk about before we wrap our quiz is nutrition. Of course, now I've talked about this on several nutrition. Why is that? When I mentioned nutrition that the hunger came? Nutrition. Sorry, swear. Now, what is nutrition? What do you understand by nutrition? What is nutrition? At least you heard the term in your biology, secondary biology. So, what is nutrition?
Is the process whereby living organisms obtain nutrients for growth and proper development.
What's your name?
Grace.
Grace. This girl will go far. I'm seeing a star. I'm seeing a star shining, and I want us to shine like that. Look at this one. This girl is a noise maker, quiet noise maker. You see that human being there? He's a quiet noise maker. Okay, you're telling me. All right, let's continue. Let's just conclude on this. Then we now. So, nutrition in health education talks about the process of providing the body with necessary nutrients, vitamins, minerals, and what have you to maintain health and what wellness. Hope you know it's not the size of eba you eat that matters. Are you aware? It's not the size of eba you eat that matters. It's what comes out, the nutrient content of the what the eba that matters. Am I communicating? So you eat, your cell is feed. What feeds your cell is the nutrients. Are you aware? So you don't eat to feed your stomach. You eat to feed your what? Cell. Your stomach may be big, but your cell may be hungry. True of us. So it's the nutrient that matters. It's about someone can get small plates of food, just small plate of food that has the required nutrients, required energy, calories, required a lot of things, and you may have one big pot of eba and or whatever food you want to eat. At the same time, that person will even have more energy. You may eat it and just sleep on and remain there because your tummy is filled up. The person will just eat that one, but the energy that whether the bottom you will be like So it's not by the quantity we eat, it's by the nutrients, the quantity of the nutrient, not by quantity of by size of the food. It's the nutrient in its content. So nutrition focus on that nutrient. Nutrient is not the. That's why if you eat too much, if you eat and fill your stomach, the that happen is that your feces will be more feces will go. Maybe the body may just take small nutrients from it, then the other one will go to. You are not that contribute in our sort of way in getting filled so easily because you eat and poop carry poop everywhere. But at the end, the body will have taken little nutrients in whether big jungle, big this you consumed. Are we together? Hope the point is clear. So let's eat to feed ourselves, not to feed our what? Stomach. So nutrition in health education refers to the process of providing the body the necessary nutrients like vitamins, minerals, and what have you to maintain health and wellness. So what is our aim here? Our aim is to promote nutrition by teaching individuals about healthy eating. By teaching individuals about what? Healthy eating habits, meal planning, and food safety. How many of us plan our meal? How many of us plan our meal? Yeah. Do you plan your meal? Don't lie, tell me. Do you plan your meal? Tell me. I'm like,
Do I play my meal?
yeah.
Like, come on.
Do you plan your
No,
meal?
I don't.
You just woke up anything that costs your money to eat.
Yes.
Do you plan your meal? I see. So share with us, how do you plan your meal? So we may learn from it. Share with us.
Like this morning, like when I wake up like Mondays
Mondays,
could be bread,
and what?
bread and tea.
Okay.
In the afternoon, I take it to school, could be rice.
Okay.
Night, conflict.
Conference, okay. Tuesdays.
Rice. I could eat rice throughout. Rice in the morning, like perhaps two. Rice in the morning, rice in the afternoon. Then breakfast.
Okay. You know that planning for your meal, yes, can be that you sit down, draw a timetable, having balanced diet in the mind, making sure that everything you are eating in a day has some contributions from the different classes of what food. Am I communicating? Hello. But the basic thing in planning is to ensure. The basic thing in planning your meal is to ensure that as you eat, that at least for a meal, at least have up to, let's say, 80%, or if possible 100% of the different classes of what food. Am I communicating? That's what meal planning is all about, with respect to nutrition. Okay. It's not about drawing timetable in the morning, noodle in the afternoon. The other one that comes like this, what do you call it? In the night, you see that what you succeeded eating that day, but you have a beautiful timetable. So what matters is making sure that the meal you all right, I think we'll stop here. Any question? Let's stop here. Some people are sleeping. So clear our decks for the quiz and bring out your exercise book. As I said, if you are not ready for it, you can go. Huh? Yes. Okay, sorry, my dear. All right. Thank you very much. God bless you.